As the mental health crisis in the United States continues to escalate, fueled by a complex web of social, economic, and public health challenges, President Donald Trump's executive orders on behavioral health remains a contentious topic. A series of directives aimed at addressing issues like suicide prevention, substance abuse, and access to telehealth services were recently signed. While these actions were often framed as part of a broader push for healthcare reform, critics argue that the orders lacked the necessary funding and long-term coordination to drive meaningful change. We have in the studio Dr. Cari Yardley, clinical administrator of Nevada County Behavioral Health and clinical psychologist, to chat with us about how state and federal policies are affecting us locally, as well as what we can do to help ourselves and those in need. Welcome, Cari.
Wow,
it's nice to have you back on the show.
Thanks, it's nice to be here.
I'm sure this is a very anxiety-fueled and confusing time for behavioral health here in Nevada County due to a lot of the executive orders and different directives coming down from the federal government and your directives from the state, and you're sort of left wondering like what's going to happen, I'm sure. Can you speak to how it's been in your department recently?
Yeah, I can, Lynn. Thank you for asking. There's definitely some confusion about what might happen and when. Right now, there's not been any substantial changes that are impacting the Department of Behavioral Health within Nevada County at this moment in time. We've had a few notices that we need to stop providing certain grant funds have been blocked and we can no longer access those grant funds, but those grant funds were already in the process of ending and were tied to COVID and the COVID era interventions that were taking place then. So we knew that they were going to be ending and we were ramping those down anyway. So that has minimal impact on what we're doing at this moment in time within behavioral health. There's been some other things that have been mentioned that do cause some cause for concern. One of the things that we are watching closely is any potential cuts to Medicaid. So within Nevada County Behavioral Health, we serve individuals who have Medi-Cal and are Medi-Cal beneficiaries. And then second to that, we serve individuals who have severe and pervasive mental health conditions. So when we talk about cuts to Medicaid in Nevada or in California is called Medi-Cal, in case anyone didn't know.
Right.
And when we talk about cuts to Medicaid, that could have a potential impact, a significant impact across the state for all Medi-Cal beneficiaries and public behavioral health systems. Within Nevada County, over 50% of our budget is from Medicaid revenue. So that is an area of concern for us that we are watching closely.
Sure, of course. And in the meantime, do you sit and brainstorm? You must sit and brainstorm about what some contingencies or some options and levers that you can push may be.
Yeah, well, there are three levers that might happen if we were going to cut, if Medicaid were going to be cut. So one of those would be reducing the eligible population of people who can receive Medicaid services. So under ACA in the Affordable Care Act, which is the Affordable Care Act, we significantly expanded the eligible population within the state of California.
As far as age goes?
Not as far as age, but as far as people who were unemployed, people who were low income, people who were had unsteady employment, undocumented immigrants, a whole host of populations that we were able to add under the Medicaid expansion and the Affordable Care Act. So when we think about cuts, one of the main cuts could happen is in our eligible population, reducing the number of people that we are able to serve. And that might be through regulations requiring that we only serve a specific population. That might be from rolling back what we were allowed to do under ACA. That might also be from imposing work requirements on individuals who receive Medicaid.
That is one of the proposals.
That is one of the proposals. And so when we think about work requirements, I think in theory that might sound like a really great idea. And within the public behavioral health system, we are serving individuals with severe and pervasive mental health conditions. But there are also other people who receive Medicaid supports and services, and those might be people with severe disabilities. Those might be individuals who are not able to work or maintain employment at the level that would provide health insurance.
So there has to be thoughtful exceptions to the general rule. So
one might hope there could be some thoughtful
that you would have
exceptions
the
to
flexibility.
that. Yeah.
Lever 2.
Yeah, so another way that that Medicaid might be cut would be limiting the scope of the services that we provide. So under CalAIM, which was a couple of years ago now, there was a huge expansion of what we were able to do to provide community-based and population-level interventions, and to provide innovative interventions in environments that we haven't done those before. So one example of that is jail in reach. So when a person is incarcerated for whatever reason, their Medi-Cal is shut off. And that means the jail is supposed to provide, historically, the services that they might need in the jail, and no external entity can bill for any services that are provided in the jail.
I see.
But what that leaves is a cliff for people who are leaving the jail system when they exit the jail system, because no services could be provided from external entities. Their services from the jail don't go with them.
Yes.
And they need to navigate this big leap or this big cliff to access the services in the community. So jail in reach is really, hey, we're going to work together with all of the services that exist in the community, and we're going to provide those services before you're released from jail to get you connected.
Like a bridge.
Like a bridge to get you connected to where you're going to go.
Got it.
So that would be an example of cutting services. Another example of cutting services is we are now allowed, or Medicaid provides non-emergency transport services to and from medical appointments, mental health appointments, substance use disorder appointments, and that is all billed to Medicaid. That's an example of something that might go away. Medicaid also funds community health workers. We have a couple in our local hospital who are community health workers who provide outreach to the community at a wider and more prevention level, and things like that might go away, as well as peer support services. So if we limit the scope of services that we're allowed to provide, that would significantly impact how we do behavioral health in Nevada County.
Sure, got it. And what about lever 3? What does that cover?
Yeah, that is a great question. So lever 3 is if we say, you still provide all the services you're providing, but the federal government is going to reimburse you less for that.
I see.
And that would be limiting limiting the amount of funding that we receive to provide these services. If any of these levers are pulled, we will have to really strategically think about what we're able to provide and how we can provide it. And right now within Nevada County, we provide a substantial amount of behavioral health services and supports related to substance use disorders, related to mental health treatment, and also related to homelessness and housing. And so if we have to think about reducing our services, we have to think about what does the state require of us in our contract with the state of California, and those mandated services will have to become our primary focus, which will eliminate...
Because the state tells you this is so.
Yeah, so Nevada County Behavioral Health has a direct contract with the Department of Healthcare Services in the state of California, and we are mandated to provide the services in that contract.
And if your mandates from California conflict with the mandates from the federal, what is the process for resolving this conflict? What do? Do you have the county board of supervisors, interject? What is the process?
I think county board of supervisors across the state might be having thoughts or ideas about how to intervene if there were a conflict between state regulations and federal regulations. I'm not sure, Lynn.
Okay, that's fair.
Yeah, I don't know what that would look like for us.
How you would resolve it, because it's happening across the board in various sectors. We spoke to Nevada Joint Unions Board last week, and there's a big controversy around the same thing, where they're getting one thing from the state and another mandate from the feds. And what do you do about that when you're a little rural county, especially?
Yeah,
it hits the rural. It seems to hit the rural communities harder.
It does, and when we think about cuts to Medicaid, that hits rural counties significantly. Our hospital system is largely funded by Medicaid. Behavioral health is funded over 50% by Medicaid revenue,
including telehealth.
And that's a great question about telehealth as well. So right now, as far as I'm aware, there are not any current elimination of telehealth to Medicaid recipients. But I do know that Medicare just had a requirement that eliminated access to telehealth unless you were receiving it from a medical center. And if you think about that, that sounds like, oh, maybe that could be a good middle ground, and it could be for many cases. But when we're talking about really rural communities where their local medical center might be over an hour away,
Right.
Impacts related to transportation or related to weather and limited access to healthcare services in general may have a substantial impact if telehealth can't be provided from that person's or to that person's home.
Sure, and that makes sense. I mean, it makes sense in rural California. It makes sense in Kansas. You know, the practicality, the logistics are different than they are in an urban setting.
Definitely.
But Cari, in the meantime, you carry on, and you are treating and helping our community. And if people who want to need help and need to reach out, Medi-Cal recipients can call 530-265-1437.
Sure. So individuals, can I expand on that a little bit, Lynn? Is that okay? Okay. So individuals who are Medi-Cal beneficiaries all should have a member services card. And if they're experiencing mild symptoms related to a mental health condition, I would really encourage them to take that member services card and to call the phone number on the back and to ask for mental health support. And another alternative for Medi-Cal beneficiaries is to call our local access line. And that line is 530-265-1437. And we will do what we need to do to help get you connected to services. But let's say you don't have Medi-Cal. Let's say you are a person residing within Nevada County and you need mental health support. If you have health insurance, it is the job of your health insurance to provide you with that mental health support. And a lot of people struggle and wonder, well, how do I get it? I have not been successful. Nobody takes my insurance. I can't find a therapist anywhere. They only want to be paid cash. That's where that same card, your member services card, so if it's your insurance card, if it's a United Healthcare card, if it's a Kaiser card, whatever your insurance card is, flipping it over and looking at that member services number on the back, call that phone number. It's their job to find you a provider. And they might give you a list of providers. And when they give you that list of providers, you might call every single one and they're not accepting your insurance. Don't give up. Call member services back, the number on the back of your card, and say, I need you to find me a provider. And I would like one within 10 days because that is your right. And it is the job of health insurance plans to provide services within 10 days of your initial request for service.
That is such valuable advice. Thank you for that.
You're
I mean,
welcome.
at the end of the day, you need to be your own advocate, I think, and
you do
take advantage of what you can.
And you don't have to do it alone because member services is actually required to help you with that if you're not able to do it alone.
Right, that's very good information. Well, let's just see where this trajectory takes us as far as funding and such. Hope for the best, and perhaps we can circle back with you down the line when things become more clear and we can see exactly what you're dealing with.
That sounds great, Lynn. Thank you so much for having me
In
today.
the meantime, best of luck and thank you for your service.
Yeah, thank you.
Thank you, Cari.